Hello friends, thanks for checking out the video. Be sure to like and subscribe as it greatly helps out the channel and I'd really appreciate it. Enjoy!
What are the specific things that are happening within congregations that might foster, more positive outcomes among individuals? And I think your comment kind of links us in that direction. Yeah, it's just, just the way social media has the capacity to link us to negative stuff. What are the types of things that might be happening in churches to drive more positive outcomes?
Absolutely right, and that is indeed, one of the main factors, and something I like about this last piece we're going to be talking about, Chad, and it's called "Is it the sermon or the choir? Pastoral support, congregant support, and worshiper mental health." Because a lot of times when we think, do you go to church? You're thinking of sitting in the pew and looking up at, the preacher, the pastor, but oftentimes you're not necessarily conceptualizing or thinking about, well, what about everyone else around you and how can that be supportive? So I really like this article because it kind of looks at both sides. You have the man speaking, but then you have everyone else who in a sense is in the same boat as you. So first question is, would you say that the more socially active someone is within their, service, are they going to experience lower levels of, psychological distress, I believe is what y'all were looking at, so essentially how important is it to be socially active, or is there a difference for being socially active with your fellow congregants?
Yeah. So a little context for this study, again, with, you'll make it available. Great, wonderful colleagues that we all work together. And it's the origins of this work really go back to a project in San Antonio, which the HEB Foundation, the HE Butt Family Foundation funded us to do some community-based research looking at mental health support systems that are operating through churches, right? So in particularly in low-income communities where people often don't have access to mental health resources, there's this sort of latent effect. There's this sort of latent phenomenon where individuals are going to churches to seek mental health support. They might talk to their pastor about their feelings, how depressed they are, and the feelings of anxiety. In South Texas, we might have, young people experiencing PTSD, and big military populations, and they don't know where to go in terms of secular, professional, clinical help, but they might turn to their religious leaders. And so we got some funding to look at that. So that project was extended to look also in the Washington, D.C. area, funded, I believe, by the Templeton Foundation with another colleague at Catholic University. So that takes us to the study where what we wanted to think about, and we designed the survey specifically asking people about how supported they felt in terms of their mental health, right? Do you feel that you get mental health support? Do you feel supported? Do the people around you make you feel good? Does your pastoral church leader speak on these issues? Does your pastoral leader provide you resources to think about your mental health? And so we looked at those things and tried to think about how these might impact actual churchgoers or worshipers, their mental health. And so what we found were a couple of things. We found that the support that you get from your fellow congregants, and I'm going to avoid saying, in this particular piece, I'm going to avoid saying church too much because this sample did involve synagogues and a couple of mosques in the Washington, D.C. area. So we not only had churches, we had synagogues, we had mosques. So your fellow congregants, the people that you attend religious services with, if they're supportive, if they provide you positive well-being, a sense of well-being, they support you, that's very positive for your mental health. And it's even more positive than if your church leader or the religious leader provides that, right? Because we ask both. Do you feel supported by your religious leader? Do you feel supported by your religious community? And we wanted to, again, the 2x2 table. Right. So being supported by your fellow congregants has the strongest effect on improving or I shouldn't say improving, on fostering better mental health outcomes. Your support from your church, from your religious leader is less impactful. However, people that feel supported by both, right? So a classic interaction effect, when you feel supported by both your church members and by your religious leader, those are the people that have this most positive health outcomes in our data. So that it seems to be sort of, they work in tandem, right? Social support from your fellow congregants is nice. It's stronger than your leader support, but when the two together, that's what has the most positive effect on impacting people's mental health.
Wow. And that's, you were kind of talking about this, and that's why, for me, it may not be too surprising. Granted, I'm biased because this is the kind of stuff I love reading about. But regarding, especially like pastoral support, I was very surprised when I may have been taking one of your classes back in the day to find that, some religious institutions, right, churches, synagogues, mosques, in a sense, have their own kind of like counseling services, right? Formal or informal. Like, do you think that's, especially
Yeah.
when you think of pastoral support, like
Yeah.
that's a major factor going into this?
Yeah, I mean, I think that's what's happening. I think that we discussed that in our sort of policy implications in this section of the paper, which is to say, there might be some self-selection going on here. So we can plausibly think about a religious leader who is very in touch and in tune with mental health, speaks to these issues, maybe organizes events at the religious institution, religious organization that fosters mental health awareness, tries to reduce mental health stigma. And we can see where, if the leader fosters that environment, that's the kind of people it's going to attract, right? It's going to attract people that are more comfortable in a religious environment where that kind of conversation is happening. Because I think it's quite fair to say there might be people that are not interested in this at all. There may be people that go to church and only want to hear about the Bible or religious reading, and only want to hear about scripture, and don't want to hear anything about politics. They don't want to hear about mental health. They just want the sort of metaphysical thing to happen, some religious ritual, and then I want to go home. But you can see where there's other people where that type of, so more of a mental health awareness frame that is driven by the religious leader influences congregants to come to the church and then be more supportive of each other. So I think definitely you're onto something there.
Fantastic. Yeah, it really is interesting just kind of seeing, I think you do bring up a good point. It's so interesting, is based on the person, right? Do you have your, very stereotypical, I know people call, Bible thumpers, like, I just want to talk exactly about the word of God. I don't want to hear anything else. I don't care about, basically this whole place is, as the kids say, they say a safe space from all the politics, all the whatever going on out in the world. And I think you're right. I think that's a very important distinction, that can play an important role on if someone's even there to look for these kind of mental health, assistance, if it were. And one question, of course, is how has this, do you think, been impacted by the pandemic?
Um, I think like just about everything else, it clearly has had an impact, right? So just even at the level of having to have more remote religious experiences, church, some of the organizations that were very quick to move to a more remote space to have religious activities happen. So I think on the one level, that's it, because this paper finds engagement, being engaged, being connected to other people is helpful, right? People don't go to church so that people can tell you you know, you look lousy. You know, you go to church, people are going to say, hey, you look nice today, and it's a positive place. What happens when, you know, what happens when we shutter all that and people are suddenly not going, not attending physically? I know in Texas it was maybe less of an issue because,
Mhm.
but out here it was like, nope, that they were just closed. Religious places were closed in the East Coast. So yeah, in fact, I mean, a little prelude, maybe we'll talk about it. I'm currently working with some of our colleagues, with Terrence Hill and with Laura, uh, thinking about some of these issues and sort of the effects of COVID and online sort of religious activity and what impacts. So be on the lookout for that. We'll hoping to get something out on that work in the future. But yeah, it's a great question. And I think, you know, my final thing I'll say about COVID is I think the long-term effects of the whole COVID episode, and COVID's not done, remain to be seen. You know, I think we're going to be studying these outcomes for years and years to come about, you know, the long-term impact of this, you know, global pandemic that happened, and how we reacted and what long-term effects that's going to have.
100% agree, right? I talk to Victoria all the time about this. I was like, there are people who are going to make their careers off of studying COVID, the impacts it had, you know, sociologists, because it really is, you know, just as you said, it's not technically truly over, and right, these effects are going to go on for, you know, generations.
Yeah.
So last thing I want to ask about this paper is, are there certain practices that religious leaders can or should, you know, utilize to further kind of help moderate this association between congregant support and mental health? Because I know you started talking about policy implications y'all are discussing at the end of the paper. So can you, you know, just any thoughts on that?
Yeah, I mean, I think there's a lot of things to think about. That's a great question. And I think there's a lot of things to think about, particularly with, well, I think on the one level, you could go back to seminaries and training grounds. I think it's starting to happen, right? I think more and more that's starting to happen, but in their training, I think future religious leaders could think about some training in mental health, right? So some basic psychology, some basic principles of counseling, just to sort of prepare them. You know, in a perfect world, you know, all pastors would all will be LPCs. That's not going to happen. But on the one hand, just informing themselves. Second, I think religious leaders can get a sense of their local communities and what resources are available, and, you know, take steps to make those resources available to people in their organizations. And then I think the final piece is just this becomes, I think, more organizational culture idea. They might want to think about, you know, how to remove the stigma of even talking about mental health, right? We know that in many, for instance, in many Latino communities, right, in particular low-income Latino communities, it may be seen as kind of shameful, or amongst men, it may be seen as, you know, a weakness to talk about mental health. So I think church leaders could do a lot to start the debate and to just try to minimize the stigma attached to, at a minimum, having conversations or expressing how we feel in terms of our emotional well-being and our mental health.
Wow, yeah, and you definitely hit a chord. I think just the stigma surrounded, you know, even just talking about mental health, I think it's slowly being eroded, but it's definitely still there, right? You know, some papers talk about stuff like John Henryism and, you know, just basically hardcore masculinity, right? Like if you get hurt or you're, you know, suffering, as they say, it's like, well, suffer in silence, because you keep that to yourself. You don't let others know about it. So I think that is a very valid and important point you made.
Yeah, and I think well, the last final piece I'd say is I think that because I'm sure Yale's going to want me to get some work done today. I think that with the growing stresses and you know, structural issues that plague a lot of big American cities and rural parts of the United States, I think religious leaders need to also care for themselves. They need to care for their own mental health, and they need to look out for their own well-being, and ensure that they're in touch with access to resources for themselves to help them cope with a lot of the things that, right, because they're taking all this stuff in. So I think that's another piece too, is self-care is very important, I think, for religious leaders to think about when they're dealing with a lot of people's problems and concerns.
Yeah, I completely agree. So with that, Gabe, is there any, kind of last comments you want to leave off with everyone who's tuning in, or anything about research?
No, I would just say it's really pleased to be here. It's great to keep up with your progress from kids sitting in my undergraduate class, a professor at St. Mary's. I think that's wonderful, and your research. Other than that, I would say that there's so I think maybe it's not a great time to get a job as a sociologist, but I think it's a great time to think sociologically and to think objectively about so many of the things that are happening, in the world, and so many of the things that impact us on an everyday basis. And so I just think that the tools of social science are helpful, regardless of if you're going to go into consulting, or if you're going to go into working at a company like Facebook or Meta, Google. I think we're realizing more and more is that these behavioral science skills are really quite useful in helping people think about these problems and kind of put them in a manner that you can study them systematically and give people the kind of guidance to make the kind of decisions that they need to make. So outside of that, I'm super happy to be here. I'm glad you're doing great. I hope, I'm sure around the holiday season, I'll be running around San Antonio, and we'll have to catch up and maybe share a meal and a drink.
Absolutely, man. Always looking forward to it. Always happy when we find out you're in town. So everyone, that's it for this episode of A Social Inquiry. Thank you all so much for the chat, for the excellent questions. And then again, thank you, Dr. Gabriel Acevedo, for your time and discussing these awesome articles. Really good. I think for me, they're very enlightening, and, really tackling some issues that everyone deals with, but may not really be thinking about it consciously. So with that, everyone, until the next time, I'll see y'all. Thank y'all. Stay well, and we'll see you then.
Thanks, everyone.